My name is Andrea Dourado, and this is my case study assignment. Clinical case endometriosis. My name is Andrea Dourado, and my specialty is gynecology with emphasis on human reproduction. Endometriosis is a gynecological disease characterized by the presence of endometrial tissue outside the uterine cavity. It is a disease that causes significant pelvic pain and infertility. However, some women are asymptomatic. Endometriosis affects 6 to 10% of women, especially in the reproductive age, most commonly between 30 and 40 years old. It also can be found in 24 to 50% of infertile women and in more than 20% of women with chronic pelvic pain. It's predominant in white and Asian women, and positive family history increases the chances of occurrence of the disease. Frequency increases in cases of late gestation, nulliparity, long or intense flows, short cycles, early menarche, etc. The clinical symptoms of endometriosis are characterized by pain, dysmenorrhea, dysporeunia, chronic pelvic pain, and consequent infertility. Because it's a progressive disease, the treatment is indispensable. Usually, as treatment, I have prescribed analgesics for pain relief, oral contraceptives to induce amenorrhea, and prevent the implantation and growth of new endometrial foci, and surgery for more severe cases or when there is no response to conservative methods. As an alternative option, I recommend the practice of physical exercise, acupuncture, and a healthier diet that can be advised by a nutritionist. The nature and duration of the treatment will in general be determined by the endometriosis stages. The conservative treatment is most often used, and surgery is commonly the last resort. In addition, women's desire to become pregnant may also change the plans of conventional treatment. LMP, 32 years old, married, white, middle class, came to the clinic because she cannot get pregnant. The patient also reported feeling strong menstrual cramps since she was 17 years old. Her menarche occurred at age 14 and she never took contraceptives. Physical examination showed normal cardiac and pulmonary auscultation, bilateral pain on the palpation of the lower abdomen. Intravaginal ultrasonography showed extensive intrauterine endometrial mass. Laparoscopy showed endometrial mass in the ovaries and fallopian tubes. The diagnosis was severe intrauterine endometriosis, bilateral endometriosis of the fallopian tubes, and bilateral ovarian endometriosis. The treatment was surgical removal of all endometrial masses and contraceptive use for 1 year. After this, the contraceptive use was suspended and the patient became pregnant naturally. The greatest challenge to be overcome in avoiding endometriosis is to inform and educate the general population about the need for follow-up of a gynecologist from the first menstruation. It's very important that campaigns be done to advise that all girls should go to the gynecologist from the first menstruation, especially those with strong menstrual pain.